Hi, I'm Jessie with Ask Astanza, and today we're here with nurses Carolyn, Webb, and Holly Hashop, and we're talking about laser hair removal. So thank you both for joining us today. Holly, let's start with you. How did you get involved in aesthetics?
Okay, so I'm an RN, an esthetician, and I would say before I became those, I worked at Whole Foods, and I was actually working with the supplements and all the skincare products. And I developed a really strong interest in skin health, and I've been doing it ever since.
That's awesome. And Carolyn, what about you?
I've been a nurse for 24 years, and I did start out in pediatric trauma, but I switched over to plastic surgery when I was looking to get out of the hospital. And getting into plastic surgery and working with some cosmetic dermatologists, that is a normal parlay right into working with a lot of lasers. So I've been with lasers for about 17 years. And each time, just experiencing different lasers and really loving all aspects of how it really wholly helps the patient. So
that's awesome. And for working with lasers for the past 17 years, I'm sure you've gotten to see like a lot of changes in the technology and the industry. What's that been like to see firsthand?
Pretty amazing, because I have dealt with some of the older lasers, specifically in laser hair removal, with extremely small spot sizes. So we're talking like 9 by 9 millimeters, and to treat an entire back or legs, yes, like an hour or more.
It takes too long.
Yeah, easily. So with the new technology, with the larger spot sizes and the cooling techniques, not only does it make it easier on me actually doing the treatment, it's much more effective, and the patients, their comfort level has greatly improved.
That's awesome. And so are you a little bit newer to using laser technology, or?
Yes, so I've been using lasers for about 6 years now, so not 17, but I still have seen the jump in the past 6 years. With some of the older lasers, how slow they are with the smaller spot sizes.
You're so much luckier. You didn't have to do what I did.
I had to use some of them for a little bit.
Yeah.
But obviously with the patient comfort, like she was just describing, it used to be, you knew it was going to be hot rubber bands snapping all over your whole body.
Yeah, right.
And now it's just like virtually painless.
Yeah.
I think we dreaded the treatments as much as the patients did.
Oh,
You know what I mean?
Like, I'm sorry I'm putting you through this.
Exactly.
And
Please
you're
forgive me.
hunched over for like an hour and a half or something.
I know. I apologized a lot during treatments. I'm so sorry.
Exactly.
Yeah,
Okay,
you
let's
do.
take a break. Are you ready?
exactly.
Okay, let's go.
Deep breath. It's okay. Yeah, exactly. And like you said, you're hunching over as the practitioner and your back hurts because you have to hold that same position for them for so long. So it's like, would have been a huge inconvenience or level of discomfort for the practitioner too. So I think it's interesting too, seeing even in recent years as the technology has developed and improved, you still see a lot of med spas and practices using this older technology that's 15, 10 years old, and it's just not up to par. It's not as competitive. And that's when you usually get those poor patient reviews, right? Because they weren't satisfied with their treatment and how it turned out with side effects or their level of comfort throughout the deal. But I think it's cool that you guys have this different level of perspective, with 17 years in lasers and about 6 or so. So you've seen the double ends of the spectrum there, the newer technology and the older stuff that we've had to endure, right? It's kind of cool.
Well, your patients today are much savvier as well.
Right.
They're actually doing research on the lasers. So when you have an older laser, the newer ones, they're aware of them actually. So it is better to have a newer technology, for your business as well.
Exactly. Yeah. Patients aren't dumb. Patients do their research. If they're spending X amount of money on a treatment that they have been seeking out and wanting for a long time, you bet your bottom dollar wanted to curse there, but I won't, but that they will do their due diligence and finding the best treatment option and technology for them. So
And they know all of the different ones. They know multiple lasers out there, and they'll even ask you about multiple lasers.
Right, like, do you have such and such?
Oh, well, do you have this, or have you heard of this? And they'll ask you, like, comparison.
Yeah, much savvier. But if they have, one horrible treatment, they're not so willing to come back. I mean, even though lasers can be uncomfortable, but it shouldn't be to a point where they're truly dreading coming back to see you.
Right.
You
That
know?
is the emotional response we are not looking for.
No.
And we shouldn't have to put our patients through that either.
No, we want them to
Right.
feel great when they're leaving.
Exactly. We want to deliver a smile and like a hug at the end, or a virtual hug.
That they're thanking you for that treatment.
Right.
They're like, thank you so much. That wasn't as bad as I thought it would be.
So as practitioners, what's the most important thing you look for, not just in the hair removal lasers themselves, but in the laser companies that you choose to work with?
So I would say ensuring that you have quality technology so you can, deliver effective treatments. And then also having adequate training and support when you need it.
Right.
I think those are extremely important. Like once you've purchased a laser or you're using a laser, on a daily, weekly basis, if something goes wrong or you have questions, you just want to make sure you have support when you need it.
Yeah, I definitely. We hear horror stories of, people that we've worked with and companies that they've worked with in the past. They didn't have someone to call on if something broke, or to really dive in and teach them how to use the laser, or even just to get them started if they were a new business and they needed some business strategy and guidance there. So it's always horrible to hear about, companies who are so excited to start out in aesthetics and then they find themselves alone, like stranded on an island with no one to reach out to for some advice and guidance along the way. I think, like you said, you're only as strong as your best support and resources that you have available to you. I mean, what do you think?
I completely agree. I've actually spoke with one of your biomedical engineers, and excellent at answering questions about the various lasers that I had questions on, which, when I need that answered, I do need somebody at my fingertips, because maybe I'm with a patient at the time and I have a question and I want to be able to complete that treatment. So absolutely, that technical support is super important, as well as a good quality laser that we could really treat patients of all skin types comfortably. So yeah, absolutely.
Definitely. Which of the engineers did you talk to?
It was Josh.
Yes. Josh is a good one.
Yeah, they're all great. I've spoken to Justin as well and Jordan. They're all great. But yeah, that's really a key piece in when thinking about bringing any laser into your practice.
Definitely. And all of our engineers are certified biomedical engineers. So they are working on the devices all day long. They know the ins and outs of the technology. So because they're experts in the devices, they're able to answer your questions. And, if you're in the middle of the treatment and you need help setting treatment parameters and you're not quite sure yet, you're new to the device, they're always there to pick up the phone and call. So we kind of pride ourselves on our service team of engineers, because they're just the best. But
They are. They're also very good clinically.
Yeah.
I feel, because I have worked with other lasers where you might have a clinical question and they don't always have a clinical support team at that time, and the engineers really can't help you because they are very technical, but your guys, they really know both aspects, so it's really good that they can help, clinically and technically.
Definitely. Okay, so what do you think keeps people from getting laser hair removal treatments done themselves?
I would probably think, in my experience, over the years, a lot of patients are afraid. They hear stories from their friends and how much it hurts. Another thing is cost. I hear that a lot. But if a patient, comes in, you have time to discuss with them, first of all, cost, depending on what they're using for hair removal, whether it's, razors, which over the years, that cost adds up, your new razors and blades and all of that. Waxing, that is a continual cost. It's not comfortable as well. And with that, getting a little bit more personal is that, with waxing, you actually have to let the hair grow out and, deal with it for that short amount of time before you can then get waxed, where with laser hair removal, if you're able to experience it with a good laser and a good technician giving you that treatment, you might have a little bit of discomfort, but nothing that would prevent you from coming back in for additional treatments. And cost effective wise, it's not going to be as much
Right.
for that cost, and then you're done.
Exactly.
So in the long run, you know, it is a lot better.
Definitely.
Yeah.
And you guys have both had laser hair removal done personally, like on yourselves.
Yeah.
What did you think before you had your first laser hair removal treatment? Like, what did you expect?
Well, that
nervous?
was years ago. And it was, I mean, I definitely was nervous. And then, you know, they advised me, okay, you're supposed to shave beforehand and, you know, all of that. I was really nervous because I got multiple areas done. And back then, I mean, it was an IPL and it was painful.
Yeah.
And it wasn't that effective in certain areas.
Right.
But obviously, like we were talking about before, over the years, I've used different lasers on myself. And it's awesome, you know, where it's come now.
Right.
But yeah, I would say with patients, I think the unknown of what the actual experience is going to feel like is what scares them the most. And they've heard about burns, and then if you go on the internet and you look up pictures, then they see all kinds of like worst case scenario pictures, and so then they're like, oh, I don't know. And you know, as long as they have somebody who's knowledgeable and reassures them, and like I was talking about, quality equipment, then they'll have a good experience.
Definitely.
Yeah.